beautiful Monday morning. Good morning, Nigeria, and welcome to Perspective, your favorite breakfast show on your favorite TV channel, ConsumerHallaTV. And this is where we take a deeper look at issues shaping our society and influencing our everyday lives. I am your host with the most, Ireha Yomi Konleke. Good morning.
And today we focus on a critical and sensitive issue, medical negligence in Nigeria, between system failure and accountability. This conversation has taken center stage following the tragic death of a 500-level student at Covenant University who reportedly collapsed during a football training session. It was rushed to the institution's medical facility where efforts were made to revive him, but he was later pronounced dead. I'm Kelama Ajibola. Good morning and welcome to Perspective.
All right then, while the university has strongly denied any form of negligence, stating that emergency procedures such as CPR and the use of a defibrillator were administered, the incident has raised serious public concerns about whether the response was timely, adequate, and capable of saving a life. But behind this single incident lies a broader and more troubling reality across Nigeria. There have been recurring reports of delayed emergency responses, lack of critical equipment, and gaps in medical preparedness, issues that experts say contribute significantly to preventable death.
And this raises fundamental questions. Are Nigerian institutions truly equipped to handle medical emergencies? And when things go wrong, where does responsibility lie? With individuals or with the system itself? To help us unpack these pressing questions, we are joined by our guest today on the program, who is a healthcare analyst and artificial intelligence expert with deep insight into healthcare systems and data-driven solutions, in person of Williams Ugbomeh. Thank you so much, and that is the person we'll be having this morning on the program to help us dissect this particular conversation better.
Mr. Williams, good morning. Thank you for joining us on the conversation this morning.
Good morning, and thank you for having me. Very excited to be here and to give my insights on this topic.
All right, then. It's so good to have you once again. I'm looking forward to your analysis on this conversation we'll be having, because the last time we had you on the show, your analysis was straight and knowledgeable. It's so sad that we are having this issue because a life was lost, but there is a need. Yeah, that's the word. There is a need to have this conversation. From a health standpoint, how would you have defined the medical negligence, and how common is it within Nigeria's healthcare system?
That's two very brilliant questions. So let me just try and break it down. So medical negligence arises when a healthcare provider who owes you a duty of care to a patient fails to meet the expected standard of care in that specific situation. And that failure directly results in avoidable harm and worsening of that condition, and also can lead to death. However, it is important to clear the air that not every medical negligence qualifies as, or not every death qualifies as medical negligence, because in some cases, medicine is very complex and some patients may deteriorate despite receiving appropriate and timely care, especially in a severe or life-threatening condition. However, I would like to state categorically that negligence becomes evident where there is a clear departure from the accepted practice, such as one, delay in treatment, incorrect diagnosis, administration of the wrong medication, failure to monitor a patient adequately, or refusal or inability to provide emergency care when it is required. The problem with Nigeria at the moment is it is very difficult to understand how many people and what are the numbers of medical negligences we have, because our data collection and systems are very poor. We do not capture a lot of medical errors such as adverse events, negligence cases, which makes it challenging actually to quantify how widespread these issues are with adequate precision. But despite this, we have some good indicators, but we do not act on them, which is also compounding on the risk, because you go to some healthcare facilities, many of them will have shortage of essential drugs. There is gaps in clinical training, there's overstretched facilities, and there's a weak emergency response capacity. So the more accurate way to frame it is medical negligence in Nigeria is both an individual and a system problems, where clinicians may make errors, but the errors are more amplified by the structural weaknesses of those systems, and that limits the rate for giving timely care. That's where the problem actually lies in Nigeria.
All right, thank you so much. That was a very beautiful one. So, medical negligence is not just a facility issue, it is both from the individual and the facility. So, I want to understand the standpoint point of it being an individual thing so that we all can learn one or two things as an individual of the society who is not a medical practitioner or doesn't have any knowledge in medicine. What exactly are our expectations, or what are we required to do when we have issues like this at home? We all know that first aid is very, very important, and CPR is something that Nigerians lack knowledge of, which is very, very important. A lot of deaths could have been avoided if people knows how to do CPR. So, what is our own issue in this particular conversation as an individual in the society?
So I think for individuals in society, it varies because I think our shared understanding of how to perform a CPR or what to do in an emergency situation changes. For example, a lot of people will want to start praying. A lot of people will want to bring out their phones and record. A lot of people will want to put, let's say, palm oil in your mouth. We have varied understanding of what to do, but I'll try and break it down properly. So, in most cases of sudden collapse during physical activity, whether in schools or in sport fields or in public places, the safest approach is to treat the situation as a medical or a cardiac emergency because the likely pointer is likely to be the heart until proven otherwise. And that helps to improve the situation or the outcome of the individual that will be lying on the floor and will needing help. So the first thing and the standard effective care is begins with immediate recognition. This is not the time to start saying waiting they happen, what are we doing to do? The first thing is to everybody should give a bit of space and check that the scene is safe, and they should assess the individual for responsiveness and check that he's having normal breathing or abnormal breathing. And after that, the situation should cardiac arrest immediately. And this should trigger everybody should be on alert. You should start making immediate calls for help. The emergency services should be contacted, and there should be one person within that group that runs to go and get an AED, and another person in that team should start CPRO immediately. The CPRO must be consistent. It's not there's this particular way we need to put our hands when we are doing the CPRO, and that comes from training and exposure, and that's something that we do not have because you have to maintain a certain level of compression adequately to be able to revive the vital organs, most especially the brain, which is the one that gets to shut down quickly. When the AED arrives, the AED is connected to the body, and it has automatic prompts which tells you what to do next and what kind of shock waves to give. And following that intervention, it is expected that by the time the AED has finished doing what it wants to do, the emergency service should be here, and the emergency service should take them to the nearest hospital. So we're looking at pre-hospital care and post-hospital care. In an ideal situation, all these things should happen as quickly as possible. We're looking at between 5 to 15 minutes. And we all know that's not possible in Nigeria at the moment. And that's where the problem lies because we do not have enough ambulance services around. Our key communication to the helplines are not so great. And a lot of things are being improvised at the moment. But rather than something being planned, rehearsed, and being supported by training personnel and accessibility of equipment, the first few minutes are often not being able to be decisive by that because we do not have those equipments around. And this makes it very difficult. So following these initial interventions, the individual must be transferred rapidly to a medical facility where advanced care, including airway management, cardiac monitoring, treatment of underlying cause, can be continued. Meanwhile, by going to these places, they've already called the hospitals who are already anticipating that they're going to receive an emergency service. And that's the reason why most hospitals have A&E. But the A&E we have here is not as equipped already for such kinds of emergencies. And those are the problems. And that's where we need to really fix the system.
All right, I'm so glad we are having this conversation because as Nigerians, we all have the mentality that healthcare is expensive, and looking at it truly is quite expensive. So most of the time, we ourselves, we don't do the proper checkup we are meant to do. But that's not the scenario here. I just have to bring that in. Do most Nigerian institutions, including schools, have the infrastructure and trained personnel to manage such emergencies effectively?
So, if we assess the situation honestly, from a very honest point of view, you can think about it, I can think about it, and we will decide. The truth is that most Nigerian institutions, including schools, do not yet have that consistent infrastructure or trained personnel required to manage such emergencies. If you go to some secondary schools, you have only one nurse there who acts as she's the everything, and that is also very negligible because you might have almost 500 students to one nurse or two nurses, and that's not sustainable. So while there are pockets of excellence, particularly in some private institutions and urban centers, the overall picture is not even, because our preparedness has varied, and that is when you're talking about life and emergency, everybody is supposed to be on the same level. There are many schools that lack trained health personnel, and significant proportion of those staff are not equipped with the basic training of first aid or CPR skills. Also, in addition to this, the critical emergency equipment such as defibrillators are rarely available. I have been opportune to do an ambulance rescue before in Nigeria, and the ambulance did not have the equipment that we needed to resuscitate the patient at that time. So we had to start improvising, and that is not supposed to be the case. If you check your crash track, your crash trolley, which has your emergency medications there to try and help the situation, it should be always be stocked. There needs to be consistent stocking of this, and all the medications are required are supposed to be there. So this creates a situation whereby the quality of response is often dependent on chance, and that is crazy. And that should not be it. And rather than the system design, so the systems need to improve, meaning that the outcomes can vary depending on who is present, who is driving, what's the state of the vehicle, what's the state of the trainee that is there, and how the resources are available. So for me, while the framework and policies are there on paper, the real issue lies in implementation and consistency and enforcement, which are very critical in determining whether an emergency response should actually work when it's actually needed. So that's where I think we need to really focus on.
Well, I quite agree with you that most institutions in Nigeria don't have the necessary equipment to actually help their students to, when they have crisis issue when it comes to medical issues. I think we all went to university. Most of us here went to university in Nigeria, and we have heard cases of students dying in school where things can actually be very, very avoidable. But because there are no necessary equipment to actually save that person, the person ended up dying. And that is just a very, very sad thing for a 500 level student. A 500 level is almost done with uni, is almost getting his certificate while he was there. So I can't imagine the pain of the parents, and I can't imagine how we that were not even, we're just sympathizers, and I'm like, oh wow, 500 level students just died like that because of a simple thing that could have been done. And I quite agree with you that CPR is supposed to be a basic knowledge for every citizen of Nigeria. It should be a compulsory thing to learn in schools. We don't need to learn we don't just need to learn civic education. We don't just need to learn how to cook. We don't need to do art and craft. These are things that we need to learn right from where we are younger, because there is a level to which you do CPR, and some people have taken their time to actually, try and watch videos and learn how to do it, because a lot of deaths can be avoided. And I say it every time. People say, oh, it is the faith. It is faith. Yes, it is faith. It is your destiny. Everybody's going to die regardless of anything. But at least, have you tried your possible best to actually resuscitate this particular person? And when it comes to collapsing, you barely have between 5 minutes to 10 minutes for your brain to shut down, and then everything is just going on in your body. Nobody knows what is going on with you lying there. We don't even have, there's traffic for you to even before you even get to the hospital. The ambulance system are not working. So these are things that was why I was asking that, what is our own standpoint as an individual in society? Our own standpoint as an individual in society for me is learning to give proper first aid. What are the things that government need to put in place for people like me that I'm not in medical field to learn proper first aid. It's not just carrying red and white box and saying, oh, this is your first aid. These are things that we need to learn in schools, and I think it's supposed to be in our curricula. It's not supposed to just be something that people talk about, or CPR. I didn't know about CPR until I was probably like 15 years. That was when I know that this is what they call CPR, and most Nigerians, young children, don't even know what CPR is.
So I think one of the ways we can approach this is we can start training it from grassroots level. That's primary school and secondary schools, and up to university. So most primary schools now and secondary schools do an open day. So in the open days, we can get the parents to come and see what the children have learned, which is there can be an open day training for parents, and also the teachers will be able to bring health providers to come and teach basic CPR, because the children will be taught maybe every term as just a day or two training. What this gives them is that it continuously reinforces their minds as young people that we need to save lives. If there's an emergency, what's the emergency response time? What can we do if the situation arises? If you see your classmates, you just give, you know how children are, you give them a scenario. If you see your classmate on the floor, what do? I will run and call my teacher. I will do my hand like this on their chest. So if you start teaching that early, you've already started creating awareness within them at a very early age. And that's what we don't have. Then when you take it to the secondary level, you can start bringing the conversations such as BLS. So BLS is the basic life support training that we get, that they teach people how to do basic responding to emergencies in the first in scenarios such as that. But when you take it to the university level, you now do a reinforcement course such as the BLS again, then you take it to the ATLS, so that people will be able to understand how complex the responses need to be and how equipped they can prepare themselves. Because ideally, everyone should be able to do a CPR. Because imagine you have a heart attack or you suddenly collapse in the market. Nobody I'm sure, knows what to do than maybe start shouting, or they begin to carry you somewhere. Before they carry you somewhere, you might have actually died. So the people there that did not give you that initial first aid could have saved you, but they didn't have the knowledge enough, or the training, or the exposure to do that training. So the government needs to do a wide training on CPRs, emergency responses, and also take the knowledge gap and try and close it, because apparently it looks like it's only the medical personnel that know what these things are, and that's a failure on the system, and also failure on the healthcare system also, because everybody should be able to do this.
I'm glad you've made mention of what the government can do in situations like this. And talking about AI, we all know that, of course, it's one of the landscape of our economy. To what extent can data systems and artificial intelligence help prevent avoidable death in situations like this?
I think data and AI have become the new buzzwords now, and everybody thinks AI and data are going to save everything. But the truth is that data and artificial intelligence, they have a significant potential to reduce avoidable deaths. I'm a very big advocate of data and AI, but their impact depends heavily on how well these systems are integrated into a functioning healthcare emergency response systems, because data allows for systemic connection and analysis of information, such as one, identify the patterns in the emergency incidents. You need to track the response time. You need to highlight gaps in your service delivery and provide evidence for targeted interventions. You need to the AI is able to point out where are the hotspot zones that usually get calls, because we need to also build the proper call center, and that will be able to do navigation to our dispatch for the emergency service to go. And the AI will be able to spot the data over time and show the trend, whereby you can now start setting up ambulances at closer proximity, so that you're able to get quicker response times. The ambulances do not need to sit in the hospital. They can be on strategic junctions or wherever they are, so that once they get the call, by reducing the time from that it take for 1 hour to get there to like 15 or 10 minutes. And that short time is able to save the lives. But for example, if the data constantly shows that the ambulance time in certain areas or repeated failures in emergency management, the data can show that, the AI can show that, but that cannot be addressed until the system is fixed, which is a bigger precision for the system to see. So artificial intelligence can build on this and supporting early warning signs. I'll give you an example. I was in a conference in London recently, and one of the hospitals there came to present one of their latest findings that they did. So they partnered with a tech firm to be able to map out their emergency services. So what they did was that they were able to map out the routes for the lowest calls, the medium calls, and the highest calls. And they were able to now do a service review whereby they now had to strategize, putting more ambulances to those areas. And they were able to find out what kind of calls were they getting. Were they more related to lung issues or heart issues? So they had to now put a bit of a specialist in those kind of ambulances so that they'll get quicker care. And they were able to see what's the distance between that call zone to the best hospitals that can be there. Can we set up a small tent closer to those centers whereby they can easily get a very short, quick care that will stabilize them a bit before they move to the tertiary hospitals for care? And they did that. Also, another thing that they did was because they were getting the data for how the ambulances were moving to map out the areas, they took that information and gave it to the Ministry of Works, who then now looked at the road routes for those ambulances and found out that some of the routes, the roads were faulty or had potholes. So they used that information routing from the ambulances to try and repair the road, and that reduced the amount of time that the ambulances were commuting by about 4 to 3 minutes, and that's also improving the outcomes of those patients. So you see that beyond just responding, there's also data that we can also give the Ministry of Works who do those roads to try and improve that response time and create emergency pathways that they can follow to get the quickest way to the hospital. So data and AI can significantly strengthen decision-making, coordination, and prevention, but they must work with a system. I keep hammering on system because that's where everything is. And that system must be ready to be equipped and to act on these insights that they provide. And that's the only way you can put data and AI into a proper emergency response system.
All right, so we still have one or two conversations surrounding this topic we're having, but let's go on a short break. It's still Perspective on ConsumerHallaTV.
My name is Olubukola Ozone, a photographer and a social media enthusiast. You're watching ConsumerHallaTV. It's a consumer advocacy TV. If you have a problem, any consumer related problem, just holla at them, just like their name implies, and they're going to get it sorted for you. Keep watching, stay tuned. Thank you very much.
Hi guys, my name is Joba Jalabi. I'm a marketing communications professional. I currently lead marketing at Flash Change, a fintech startup. Keep watching ConsumerHallaTV, a consumer advocacy channel.
Hello, my name is Sharon Rotimi. I'm an actor and I am on ConsumerHallaTV. Now, ConsumerHallaTV is a consumer advocacy channel. So if you have any issues, consumer-related issues with brands and services, you can reach out to them and they'll be sure to handle it or to cater to you. Thank you so much.
Hi guys, my name is Williams Adejumo. I'm a film poster designer and illustrator. This is ConsumerHallaTV. It's a consumer advocacy channel. We show content on consumers-based news, entertainment, and all of that. So I urge you guys to stay tuned to ConsumerHallaTV.
My name is Anoluwapo Alao, a sales consultant for Star Times Nigeria. This is a ConsumerHallaTV where they discuss anything consumer needs and you get knowledge about anything about consumer. So keep watching.
Hi, my name is Adebola Ogushino. I'm a filmmaker and you're watching ConsumerHallaTV. Any consumer related issues, they've got you.
Hi, my name is Stephen Olorunshisi. I'm a strategy and sales professional, currently working with Obey, and you're watching ConsumerHallaTV. I mean, this is one of the channels that you don't want to but stay on. Consumer advocacy, brand promotion, everything consumer, what you need to learn for your business to grow. This is
a channel where you learn, where you experience entertainment too. Yeah, but it's good for businesses, for brands, and for an entrepreneur. If you want to know more about businesses, want to know more about brands, please stay watching. All right, thank you so much, ConsumerHallaTV. Keep watching.
Hello, good day. My name is Tunde Balogun. I'm the lead pastor at the Kingsborough Church in London. And you're watching Consumer Hala TV, which is a new initiation into the TV industry in Nigeria, the first of its kind in Nigeria. And I know that it's going to bring value and quality into the service industry. Consumer Hala TV is here to offer value to service industry and to give a voice to consumers, bring awareness to the brand industry, and also bring education to what it is to have quality for what you paid for. I know that through Consumer Hala TV, you are going to be able to get what you have paid for quality-wise and also give a voice to you in wherever it is that you do. I am here to support and give a shout out to say that keep watching Consumer Hala TV and we'll have a better quality for value in Nigeria and in the global space. Please continue to watch Consumer Hala TV because it is here to make things work better for you. It is on this note that I would like to say a big congratulations to the chairman and CEO of Consumer Hala TV, Pastor Tunde Olufowora, and all the staffs of this.
Welcome back from that short break. It's the perspective on Consumer Hala TV, and we are having a conversation dealing with medical negligence in Nigeria. And it's so sad that a soul was lost over this at Covenant University. And we have Mr. Williams Ugbomeh. He's a health expert and also an analyst joining us on this conversation. Mr. Williams, it's good to have you back. What immediate and a practical improvement would you recommend to strengthen emergency response system across Nigeria?
That's another good question. Well, there are several immediate and practical steps because we need to move to action phase that can be taken to strengthen emergency response systems across Nigeria. And most of them are very achievable and scalable. I think off the top of my head, I can think about 5 just without even deeping into much. The first one is every school. Just taking an example to what has happened, the tragic incident. Every school, workplace, and public venues should be required to have a clear and functional emergency response plan, which outlines which specific roles and responsibilities and actions to be taken during an emergency, rather than relying on an ad hoc decisions. Because I'm sure that that scenario there at Covenant may have relied on maybe getting the hospital nurse or the doctor there to respond quickly. They did not really. Secondly, there should be a nationwide push to train key groups such as teachers, coaches, security personnel, community members in basic first aid and CPR, because in many cases, the first responders are never the healthcare professionals, but the nearest and available are close to that scenario. So it could be your brother, it could be someone else that you care about deeply. Thirdly, we need to provide the AEDs, which is the automated external defibrillators. They should be deployed at high risk and high traffic areas, including schools, sports centers, facilities, even wedding venues, to be honest, and public gathering spaces. And these devices should be regularly checked, maintained, and should be easily accessible, just the way we have them in Europe. Fourthly, emergency communication systems need to be simplified. If you ask someone on the street now, ask them, if there's an emergency, who do I call? They don't know, to be honest. So emergency communication systems should be simplified and strengthened with clear and widely known emergency numbers, improve ambulance dispatch systems, and better coordination between pre-hospital and post-hospital, hospital, and post-hospital care. Fifthly, there must be a strong culture of accountability that is driven by data, where every serious emergency incident is reviewed in a structured way to understand what has happened, why it happened, what failed, what was successful, and what can be improved on. Because without learning from these events, the same gaps will persist and the same outcomes will continue to repeat itself. So I think those are the recommendations I think off the top of my head we can actually work on, and they are scalable and they are very much achievable.
All right, then, thanks, Mr. Williams. Talking about this, of course, there is something we call data transparency. We all know that the news is out there to the audience, and of course, the reputation of this university is at stake as well. So, from your medical angle, what advice can you give to the school in terms of maybe an autopsy report, just to clear the head of the situation?
So I think the thing the hospital can do is broken down into three ways. They can do a hospital decision, the family decision, and also the decision for the general public. So for the full decision, we can do is to issue a very public statement and explain exactly what has happened. Because the fault did not come from them. We need to back this up by the numbers, what was done, what eventually happened, the whole scenario, and also sympathize with the family. If they want to take it further, they need to organize a wide training for all the students now, because before they will have gone to report to their seniors or whoever was on ground that acts as a superior to try and take them to the hospital, that could have saved the person's life. So they need to now do a training. That's this BLS and this ATLS I'm talking about. And everybody needs to participate in that. And they need to issue certificates to show that the students went through the course. And these are the action steps we are taking. They need to put more defibrillators at the cafeteria, the church building, the sports complex, in their classes, all those areas that they know that people usually gather. Also, they need to sympathize with the family and ask for, if family wants to do an autopsy report, because some families do not really like to go into all those kind of details. They can also do that and also let the public know that the cost for this could have been something else and is not directly inflicted on the school. However, they sympathize and they are actually taking responsibility for it, and this is the action. Then probably support in a certain way towards the burial. It's just to show beyond an institution you have empathy, because a life was lost, irrespective of all the big grammars we are going to speak. You need to show that you care, because that could be anybody's child, and you need to show that level of care and concern. And also the students who need to take a bit of rest, where we need to ensure that between different levels of classes, between 100 level to 500 level, we need to bring out CPR or health champions among those groups. It mustn't need to come from the medical students. Within each department, we need to have a group of 5 to 10 people that are our CPR champions or our advocates, and they will be able to pass the knowledge more to their classmates, and we can have repeated scenarios and do an emergency response and say, we have an emergency on the field today, what are we going to do? And people begin to act in the coordinated groups to see how fastly they can get their colleagues to maybe the hospitals and the health centers around there. And that's what they should do. And that's, I think, how they should approach it.
All right. Thank you so much. Thank you so much, Mr. Williams, for that beautiful note right there. But let me quickly turn to Barrister Omobolaji. Thank you so much for joining Perspective this morning, Barrister. Can you hear me? Good morning, Mr. Barrister Omobolaji. All right, is here to answer our greetings. So we've had a beautiful conversation with Mr. Williams this morning, and he has provided beautiful insights. And I think these are recommendations that we need to take to heart as Nigerians, as individuals, as parents, and also one of some people's first aid. Sometimes they may reach out to us first before any other person. Medical is something that the hospital is something that will come in later, or maybe like 30 minutes even before that, because we have crazy traffic in Nigeria, especially in Lagos State. It is a conversation that we really, really need to have.
Absolutely,
and also with the emergency responses that are quite delayed most of the time. Even our emergency response line is not active, it's that active. These are conversations that we really, really need to have. But before that, and as we wait for Barrister Omobolaji, let's go on a short break and we'll be right back. in the world today, everyone is a consumer. And as consumers, we all have the right to be heard.
In Nigeria today, as a consumer, you have all right to product information, right to fair pricing, right to return goods, right to product labeling, right to fair dealings, and a lot more.
Well then, have you heard about the new media channel?
ConsumerHallaTV.
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 At ConsumerHallaTV, our goal is to inform and educate consumers in Nigeria with insightful news alongside development within the fast-paced world of consumers through well-researched, specialized, and analytical content.
Our vision at ConsumerHallaTV is to create an engaging platform that provides right connections for meaningful brands in Nigeria, thus creating a more caring world for consumers where business thrive.
And guess what? Our ConsumerHalla brand is the first consumer complaint resolution portal in Nigeria, powered by a 72-hour feedback mechanism. We offer consumer advocacy, informative talk shows, branding promotions, advertising, and lots more. Connect with us via our YouTube channel at ConsumerHallaTV. Follow us on our Facebook page, ConsumerHallaTV, our Instagram page, ConsumerHallaTV, and do well to subscribe to our YouTube channel. Subscription is free. ConsumerHallaTV. At ConsumerHallaTV, you deserve to be heard.
At ConsumerHallaTV, you deserve to be heard. All right, welcome back from that short break. And we are still talking about the medical negligence in Nigeria relating to the 500 level student that lost his life at Covenant University. And Mr. Williams has been on the program with us, and we have to let him go right now. Thank you so much, with Mr. Williams. All right, thank you so much, Mr. Williams, for joining Perspective this morning. We really do appreciate your insight. Good morning, Barrister Omobolaji.
Yeah, good morning. Can you hear me?
Yes, sir, we can hear you loud and clear. Thank you so much for joining us.
You can hear me loud and clear, all right.
Yes, I can. Let's quickly ask this question because this is what we really want to know. When it comes to medical negligence in Nigeria, this is not the first time, and it's looking like it's not going to be the last time this is going to be happening in Nigeria. What is the legal implication when it comes to medical negligence where a life like this is lost in Nigeria? What determines it, and what are the consequences of the actions here?
Hello, sorry, my host. First and foremost, I need to get your question right. I think you were asking me what constitutes medical negligence in Nigeria.
In Nigeria,
did I get it correctly?
Yes, yes.
All right. You see, when we talk about medical negligence in Nigeria or anywhere else in the Commonwealth world, we are talking about the same thing. You see, what constitutes medical negligence in Nigeria is the same thing that constitutes medical negligence in all Commonwealth countries of the world. And I'm sure in civil jurisdictions as well, what is negligence in Nigeria is going to be what is negligence over there. Now, let's talk about negligence. When we are talking about negligence, basically, or simplicity, what we mean is failure to do that which you ought to have done, or neglect.
Barrister Omobolaji, are you still there with us? Okay, absolutely. Barrister Omobolaji is not there. Okay,
when
he's back.
We now situate it, yes. When we now situate it within the context of medical negligence, we are talking about a doctor or a medical person who in the course of treatment or administration of a drug regimen, you understand, failed to do that which he ought to do, or did not take due cognizance of what he is not supposed to have done, and he did it. That is basically what we call medical negligence. And it is a strict legal term, such that there are things which must concur together before we can make a finding of medical negligence. One, there must be what is known as duty of care. And when we say duty of care, what do we mean? Everybody do not owe everybody a duty of care. Now, if I'm going to explain duty of care, let me use, for example, somebody who is a driver driving a motor vehicle on the road. You owe a duty of care to every other road users, be it pedestrian or other driver. What is that duty? Duty not to cause harm. You owe them that duty of care. Now, let's now look at this instance. Somebody who is a driver, you understand, then you are driving, you are sending text messages or looking through your phones. You understand, you are setting yourself up for a breach of that duty of care which you owe to other road users. And in medical practice, that duty of care is presumed. Once you find yourself in a hospital or in a circumstance whereby you will be consuming medical treatment, we are looking at it as a consumer product now. When you will be doing it, when you are in the hospital, the law presumes that the hospital owe you a duty of care. You understand? Now, we have talked about the duty of care. Now, we now talk about the breach of that duty of care. Now, what is breach of that duty of care? That is what in law is known as the failure to do that which you ought to have done reasonably, or to refrain from doing something you ought not to have done. Like the other example I was giving of a road user or a driver who is typing while driving. Understand? And in the process of typing while driving, you hit a pedestrian. You understand? Now, three elements have concurred in this situation. All the four elements of negligence. Now, the duty of care, which I believe we have explained, and I believe we have also explained the breach of that duty of care. Now, the next thing is causation. In causation, that is when we are looking at the proximity between the breach of that duty of care and the resulting injury.
Okay.
You get? Because
Yes,
before you can say someone has committed negligence, all of these four elements must concur, which is duty of care, breach of that duty of care, causation. Now, in causation, there is something we refer to as the but-for test. But for that breach of duty, this injury or damage would not have occurred. You get?
All right.
You must situate the resulting injury within the context of the breach that has occurred, and that if the breach had not occurred, there wouldn't have been this injury. You understand? Then we now
Yes,
go
sir.
to the last leg of the element that must concur. That is the resulting injury. If everything concur, the number one, that's duty of care, the breach of duty of care. Yes, also there is a concurrence between the act which caused the breach. That's I'm talking about causation. If there is no resulting injury or no resulting damage, negligence cannot be said to have occurred. For negligence to be said to have occurred, all of these four acts must occur.
As being, yeah.
It is after their concurrence that we can now talk about negligence as happened.
Barrister Omobolaji, I'm so happy that you're bringing your legal experience into this conversation, but apologies from our end due to a time factor. We'll not be able to push this further, but we hope to see you for more conversations and perspective very soon.
Okay.
Thank you so much for joining. Thank you so much for joining us, Barrister Omobolaji Adejumo.
I was actually looking forward to an exciting discussion with you. Perhaps maybe we will reschedule.
Absolutely,
By God's
absolutely.
grace.
And we look forward to have you too.
Exactly, sir.
We look forward to have you too as well.
All right, you're welcome. Bye-bye.
His analysis were knowledgeable.
They're very knowledgeable.
All right, Barrister Adejumo Omobolaji Tribute, the legal practitioner, bringing in legal experience in this conversation about medical negligence in Nigeria between system failure and accountability. According to health and legal analysis, medical negligence is not only about wrong treatment, it also includes failure to act promptly, inadequate care, or the absence of proper system during emergencies. In many cases, what should be a life-saving moment become a fatal delay.
And it's clear as day that this issue goes beyond a single incident. It reflects the strength and preparedness of our healthcare system, and it also raises concerns about whether accountability mechanisms are strong enough to protect lives in Nigeria.
Medical negligence, of course, is not always about intent. Sometimes it is the result of delayed action, inadequate system, or lack of preparedness. But regardless of the cause, the consequences are real. Life lost and families left searching for answers. We thank our guest, Mr. Williams Ugbomeh and Barrister Omobolaji Adejumo for their valuable insight. Join us again on Perspective next time as we continue to explore issues that matter. I am your host, Ire Ayomikoleke. Follow us on all our social media platforms.
I'm Kikelomo Ajibola. Thank you so much for joining us for another insightful edition of Perspective, and we hope to see you by Wednesday for another beautiful conversation. Good morning.
Good morning, Nigeria.